Hey, you guys. My friend recently suggested that I get an HIV test, and I was like, okay. I'm embarrassed to admit I don't really know what that means or how to get a test for HIV. Can you please explain it to me?
Don't be embarrassed. Sure, we can explain. HIV is a virus. H is for human, I is for immunodeficiency, and V is for virus.
That's right. It's a virus that can get into the body and can cause AIDS.
AIDS? Is that also an abbreviation? What does it mean?
The A is for acquired. I is for immuno. D is for deficiency. And S is for syndrome.
Oh, okay. If you get HIV or AIDS, is there a cure?
There's no cure for HIV yet, but there is very good treatment. There is now medication to stop the body from developing AIDS if you have HIV.
So, after someone gets HIV, the body can't get rid of it ever?
Unfortunately, no.
But now, with medication and seeing your doctor regularly, most HIV positive people can live long, healthy lives.
That's correct. We have what is called the immune system. When we get a cold or food poisoning, our body has specialized cells that fight invading organisms like the cold virus or bacteria in food. That protection is what we call the immune system.
HIV is a sneaky virus, though. It seeks out and infects one specific kind of specialized immune system cell called the CD4 cell.
Oh, what does the CD4 cell do?
The CD4 cell orchestrates other cells in the body. They communicate to other cells in your body that have a potential infection. This way, the body can come together and fight it.
CD4 cells help to fight off everything from little colds to rare brain infections and even help stop cancers. HIV likes to kill or weaken these CD4 cells.
Oh, that doesn't seem good.
No, it isn't. It basically means that the immune system stops working and goes haywire. Without treatment, the number of CD4 cells in the body goes down, and people with HIV start to get many infections or even cancers.
These infections only affect some people with weak immune systems, and they seize the opportunity. This is why they are called opportunistic infections. That is the last stage of HIV, called AIDS, and usually takes several years to develop. But now, with medications, we can protect the immune system and stop opportunistic infections from happening.
So, we can prevent getting HIV?
Yes, that's why we want everyone to get tested regularly. If people with HIV are on the right medication, their treatment works to prevent giving HIV to someone else.
There is also medication HIV-negative people can take to minimize the risk of getting HIV.
Yes, that's called PrEP, which stands for pre-exposure prophylaxis. Just taking a pill every day can lower the chances of you getting HIV.
And HIV-positive people taking medication are practicing what we call treatment as prevention, or TASP. People who have HIV already can prevent giving other people HIV just by taking medication which specifically works to reduce the amount of virus in their blood.
Who should think about HIV testing?
Anyone having sex should get tested. So, everyone who is sexually active, especially people having anal sex or people having sex with other people who have HIV.
Why anal sex?
That's really interesting. Research shows that inside the anus, or the rectum, there are lots of CD4 cells right there in the mucosa, which is the lining of the rectum. Also, sex is more likely to cause little tears in the tissue, small ones that might not even really bleed.
That's right. These little tears make an easy way for HIV to enter the body. So condoms and other barriers are really important to prevent acquiring HIV and other sexually transmitted infections, or STIs.
But what about other kinds of sex?
HIV can spread through both vaginal sex and anal sex. But it's important to note that we know that anal sex poses a higher risk for infection.
Basically, if you are exposed to blood, semen, vaginal secretions, or breast milk with HIV in it, you may be at risk of becoming infected. You cannot get HIV from saliva.
The other big way to transmit HIV is through sharing needles for injection drugs. It's also possible to contract HIV through needle sticks if you work in a healthcare setting. It's also possible to transmit it if you use needles for medications and do not change or clean the needles in between injections.
If someone has HIV, uses a needle, and then you use that same needle, you can get HIV that is hiding inside that needle. People who use needles can go to a needle exchange center or use bleaching kits to clean the needle.
Wow, that is a lot of information. Kind of confusing.
I know. Just try to remember these 5 key points. Number 1, get tested regularly for HIV and STIs. Number 2, if you share needles, exchange them for new ones or make sure they are clean. Number 3, if you have sex, talk to your partners about safer sex, including condom use or other protective measures. Number 4, if you are HIV negative, talk to your doctor about whether you should take medication for HIV prevention. There are now several options for the medication called PrEP, which stands for pre-exposure prophylaxis. Taking PrEP daily can prevent HIV. And finally, if you are HIV positive, taking your medication every day prevents giving other people HIV. This is called TASP, or Treatment as Prevention. TASP.
Also, if someone tells you they are HIV positive, it may be private. Some people are activists, loud and proud about having HIV, and others prefer to keep it private because of stigma.
Yes, unfortunately, people still get fired for having HIV, even though there are laws against it. That's another example of stigma.
I think my friend is right. I need to get tested. But that seems overwhelming and I don't know where to start. What should I do?
Well, you're in the right place to continue the discussion.
That's right. Keep watching these vlogs to learn more.